In this overview of how to create ED notes, we will walk through a typical workflow for reviewing your patient's condition, chart details, and then create your note. After opening the patient's chart, the ED Viewpoint ED Summary screen will display. On the menu, click ED Note Workflow. The intent of this workflow is to make your note a byproduct of your normal workflow. All of the following patient care details can still be found in the existing sections of the chart, but to make the process flow better, we've developed a single page that encompasses most, if not all, of the details you need to create an accurate and complete note. We'll start. Information from the triage assessment displays here. Next is Documents. Here you will see a list of any previous signed electronic documents based on the time frame selected. Any changes to the time frame will remain as you move from patient to patient. This is currently set to show all ED notes and clinical summaries, hospital and H&P, consult, discharge summaries, OP reports, stress, cath, and GI reports. You can click on a note to open and view it, or you can change the view to a pane view, similar to how your email displays a message. Then you can use the down arrow or click to move from note to note like you would in a paper chart. Home medications are listed here and includes all home medications. This list pulls forward from any previous hospital visits, so it is important to verify that this list has been updated during this encounter. The easiest way to do this is to look at the medication reconciliation status bar in the medication section below. A green check mark next to medication history signifies that the list was verified this. In the ED active medication section, you will first see a list of scheduled medications, which are ones ordered but not yet given, continuous infusions, PRN medications, and what has been administered in the last 24 hours. Clicking the header will take you to the MAR summary section. To return to the workflow, just click the back arrow. Next, the list of allergies displays. Document any new allergies by clicking the plus sign and entering under the allergies page. Next is the vital signs section, showing the most recent vitals results. The past medical history problems section is a list of historical or chronic problems. If the past history is wrong or needs to be updated, highlight the problem and use the menu to correct. Options include Resolve for problems that have been corrected, like diabetes corrected by gastric bypass surgery, and Cancel for problems which should be removed from the list. If during your review you need to add a new historical or chronic condition, click on the Add New As option and choose Chronic or Historical. Then type the condition in the search field. As you type, a list of conditions will display. Simply click on the one that applies, and it appears on the list. Under Past Surgical History and Procedures, you will see a list of prior procedures and surgeries. If this needs to be corrected, you must click the header. On the Procedure screen, click Add. Click on Favorites to locate the procedure, or search for the procedure. After finding the correct one, click OK. Then return to the workflow. Be sure to refresh on the workflow to update the list. The next section is Social and Family History. Nurses typically capture social history, and that information will display here with the date and time that it was captured. If this needs to be updated or documented, click the down arrow next to the header and select ED Provider Family and Social History. The Power form opens where you can make additions and changes. Sign the form, and the information updates on the workflow. The History of Present Illness section is where new documentation begins. Here you can free text or use Dragon to add your documentation. It is important to remember to capture 4 HPI elements when you dictate, or note why you are unable to do so if there is limitation to history evaluation. In the Review of Systems section, use auto text such as dot macros or drag in to add standard normal macros such as ROS template, which you can then edit. Use the drag and forward key to navigate from system to system and update normals with patient-specific findings. If specific ROS items were captured in the HPI, you could simply note CHPI in that system review. There are also other ROS macros available depending on your workflow. Similarly, in the physical exam section, you can also use auto text or drag in to insert a comprehensive normal physical exam template called Exam Template, and update with patient-specific findings. Additional systems can be added based on specific patient exam, like back pain exam, rectal exam, and various comprehensive templates are available based on patient exam type, such as trauma, pediatrics, and psychiatric. In the Labs section, you can see all of the resulted labs during this encounter. If you need to see previous encounters, click the header Labs to go to the flow sheet. Here on the workflow, hovering over a result will give you more information. CBC and chemistries will automatically be pulled into the note, and any other results you'd like to add to the note can be added by right-clicking on the value and selecting Tag. Microbiology results during this encounter display next. This section is view only, so you cannot tag results here, but you can click on the report to open it and view information. Later, when you create your note, you can access the document from the list and tag results there. In the Diagnostics section, you can view reports. In the Status column, you will see the status of the order. Statuses include ordered for orders placed but not yet completed, authenticated and verified for completed orders with dictated report available, and unauthenticated for orders completed but not yet resulted. For orders not yet completed, clicking on the order will bring up a window with more order details. Clicking the order name will open the report. From here, you may highlight a specific section of the report and tag it to save the information to later be inserted into your note. Tagging can be used in any document, lab results, or vital signs. Next, outstanding orders from triage, which have not been completed yet, appear in the Outstanding Orders section. This is information only, but you can hover over these orders for more information, such as who placed the order. The new order entry screen may look familiar to you. The folder that you currently have set as your home folder will appear. For most, this will be the Emergency Department Favorites folder. To see more orders, simply hover your mouse over the arrow on the right. The orders will slide across the screen. Ordering is as simple as clicking on the Order button. You can order individual labs, medications, radiology tests, and care sets. For care sets, you will be prompted to modify the details after you sign. Navigate to the Order inbox, which should turn green with an active order count. The order confirmation screen will appear with a brief description of the orders you selected. You can remove an order by hovering over the order and clicking X. If there are details you want to modify before signing, for example, change the dose of a medication, you click Modify. If the order sentences are correct, you may simply sign. Remember, modification of care sets will occur after you sign. You do not need to hit Modify. There is also new ordering functionality in this section, which allows you to easily order singletons by using a Google-like search to find specific order sentences in the entire order catalog. For example, to order Levaquin 750 IV, type Levo 750 IV. The more specificity you use for order, route, reason, the better the results. For example, to order a chest CT for PE, type chest CT PE. Make sure to be careful using this functionality. You do still have to verify and sign the orders. The Assessments and Forms section provides access to common provider forms. Click on the drop-down arrow to choose a form. This opens the Power Form where you can complete the information and sign. Create Note. Select ED Teaching Physician Record from the Type drop-down. Then choose the template based on the data you want imported into your note. We'll use ED Physician Record and Teaching Note, a full ED note with a section for a supervisory attestation statement. Once you select the template, the title automatically updates for you. Click OK to create your note. The information you entered during your review now appears in the note. Basic information brings in the chief complaint. Navigate through the history fields by using the F3 key or Dragon navigation button. Place an X and fill in the appropriate information. If the information was already dictated as part of your HPI or not required, you may remove this section by clicking the X. Under Physical Exam, the most recent vitals also pull in, not the triage set. The CBC, basic chemistries, and any labs you have tagged will automatically populate into the Lab section. Diagnostic tests, including EKG orders, will also be pulled into your note and provide a space for you to dictate findings using Dragon macros, which can be edited. Radiology orders are also pulled in, and you can drag in tagged results. On the far left side of the screen, you have any tagged results from your review of the patient's chart. You can click and drag those results into your note, and the original author of those results will be footnoted. Problems and Procedures carries into your note with a section that allows you to indicate, either by typing or using Dragon, the status or details of that condition and course of care. You can also delete any you don't want to include by using the X. Clicking the main refresh will bring it back. Information can be added here, but it does not update the control information. All sections on the right-hand side can be refreshed individually to bring in more current data. This is especially important in the case of history, home meds, social history, where you may begin documentation before the nurse has captured this information. Labs can also be refreshed after they are resulted to bring into the note. In the Assessment Plan section, use Dragon to add your differential and medical decision-making plan. In the pilot project, you'll be completing a full ED note that can replace the T-sheet, but we'll be doing this as a supervisory note. Place supervisory statement in the ED attending note section using the Dragon macro attestation resident. In the future, this particular note will be used when you do a synchronous evaluation with the resident. Now that your note has been updated, click Save and Close. This will save your note so you can open it later and continue documentation for your patient. You will be continually updating the same note under the ED Progress section. At this point, do not select Sign, which will finalize the note and not allow for continued documentation later. You can access the note later by going to the Message Center, and saved messages will be there. Double-click the note to preview and select Modify. The note will open. Refresh the sections like Labs and Diagnostics to view the most recent information. Accessing this way will not allow for labs and RADs to be tagged. Then, in the ED Progress section, use autotext.sign to add your name, title, date, and time. Then update with your progress information. When complete, click Save and Close. Another way to access the note is on the ED Note workflow in the patient's chart by opening the In Progress note under Documents. Refresh the Results sections, and in the ED Progress section, add the time and date, signature stamp, and update your documentation using free text or Dragon. When complete, click Save and Close. You may open and close the note and continue to edit as many times as you need. When the patient is ready to be discharged, work through the ED Depart Summary tab. All of your discharge documentation can be completed here. This includes a new Power Form for work and school notes under ED Provider Depart. When complete, there is an option for Documents, where you can click and open a note. On the note, click Modify. Then in the note, use the AutoText or Dragon macro ED Discharge. This pulls in all your discharge information into the Final Impression Disposition section of the note. When complete, sign and submit. Information can be addended later if necessary. We are working on similar functionality of the admit process. For current state, please make sure to document admission status and final diagnosis. If it's the end of your shift or you are signing a patient out, indicate this in your ED note. Open your note and remove the Final Impression Disposition section by hovering over the title and clicking the X. Then, in the ED Progress section, use the Transfer of Care auto text. Refresh the Labs and RAD sections to update with the latest information. Then click Sign and Submit. If you are receiving a patient at sign out, you will continue to document on the same note. by accessing from ED Workflow and then modifying the note. You'll then add your documentation under the Addenda section. Use .sign or drag-in .sign, and then free text or use drag-in to add additional documentation and updates. You will have additional smart templates to use to insert vitals and to insert labs. Use the same discharge process as described before if the patient is being discharged, or complete an admission disposition diagnosis if the patient is being admitted. Each time you addend the note, you will sign and submit. Your added information is denoted by Document Contains Addenda and will display at the bottom of the note.